Why get a thyroid FNAB for a follicular lesion? Have you ever wondered why a fine needle aspiration biopsy is recommended for a follicular lesion in the thyroid? This procedure is essential in helping doctors determine whether a thyroid nodule is benign or potentially cancerous. Follicular lesions can vary widely, ranging from harmless nodules to more serious conditions like follicular carcinoma. Understanding this distinction is crucial for effective treatment. One of the main reasons to perform a fine needle aspiration biopsy is risk stratification. Many follicular lesions appear indeterminate under a microscope, meaning they do not clearly indicate whether they are benign or malignant. The fine needle aspiration biopsy helps classify these lesions into categories like follicular neoplasm or follicular lesion of undetermined significance. This classification is important because it informs the risk of cancer associated with each type. For instance, follicular neoplasms have a cancer risk of about 15 to 30%, while atypia of undetermined significance has a lower risk. Another key benefit of the fine needle aspiration biopsy is that it can help avoid unnecessary surgeries. In the past, patients with follicular lesions often underwent more invasive diagnostic surgeries to establish a diagnosis. The fine needle aspiration biopsy is a less invasive option that allows for an initial evaluation, potentially reducing the number of surgeries needed by identifying nodules that are likely benign and can be monitored instead. The results from the fine needle aspiration biopsy can also guide further testing. If the results are indeterminate, additional procedures like repeat fine needle aspiration, core needle biopsy, or even molecular testing may be recommended. These steps help better assess the risk of malignancy and determine the best course of action. Integrating the fine needle aspiration biopsy findings with patient-specific factors is also important. Factors such as age, gender, and ultrasound characteristics play a role in decision-making. For example, younger patients and males with follicular lesions may have a higher risk of cancer, which could influence how urgently treatment is pursued. However, it is important to note the limitations of the fine needle aspiration biopsy. While it is a valuable tool, it cannot definitively distinguish between follicular adenoma, which is benign, and follicular carcinoma, which is malignant. This distinction requires evidence of capsular or vascular invasion, which cannot be assessed through cytology alone. Therefore, some patients with a diagnosis of follicular neoplasm from the fine needle aspiration biopsy may still need surgery for a conclusive diagnosis. In conclusion, the fine needle aspiration biopsy is a critical, minimally invasive procedure for evaluating follicular lesions of the thyroid. It helps stratify cancer risk, guides management decisions to avoid unnecessary surgery, and informs the need for additional diagnostic procedures. While it has its limitations, it remains an essential part of thyroid diagnosis and monitoring. Always consult with a healthcare professional for personalized advice regarding thyroid health.